Ever felt like your EHR was working against you instead of for you? More clicks, more cut and paste, and more burnout than actual benefit? Well, that's exactly the frustration that Oracle Health set out to fix with their brand new EHR. I'm joined today by Seema Verma. She's the Executive Vice President and General Manager for Oracle Health and Life Sciences. In this interview, she breaks down why Oracle went all in on AI for their new EHR. She also talks about why this approach is superior to the approach that many others have taken, what she calls AI as a bolt-on. Oh, and there's a surprising story she shares about what happened when doctors tried their new EHR for the first time without training. Stick around for that. Let's get to it. Seema, welcome to the program. I am very, very excited that you're here. I am truly excited to have this chance to speak one-on-one with you. I usually see you only up on the stage, so thank you for agreeing to come on our program today. I know you're in a little bit of a time crunch, so I will dispense with the normal pleasantries that we would normally do and just dive right in because I really want to talk to you about this exciting new release from Oracle, the official announcement of the new Oracle EHR, which is really, really heavily based on AI. And of course, that you'll be previewing at the Oracle Health Summit that's coming up. So just want to dive in there and ask you some questions around this new EHR.
So Oracle's had a long history in tech. They've also had a long history in innovating in different sectors, right? So whether it's been banking, communications, construction, hospitality, restaurants, I mean, they've done a lot of work in transformation. And so I think when we got into healthcare, there's a playbook, and I think Oracle's very experienced in driving transformation. When we looked at sort of where we were just in terms of where technology is. I mean, Oracle's had a long-standing investment in AI, so AI is not new to the company. And looking at Cerner and looking at how that was built, right, in an older database, I think one of the first things that we did was decide that we needed to build a semantic index, right? And so I won't get too technical here, but it basically is a way of organizing the data so that you can then deploy AI. And I think if you don't have that semantic index and you don't have that organization of the data, it's very difficult, especially in healthcare. And I think the thought was that you can't do that on old technology. So one of the things that we see in the market today is that our competitors are using very old technology. They're using 1990s databases, and those are not built for AI. And so from our standpoint, where we sit, if we wanted to be able to deploy AI, leverage AI to reduce burden on providers, to be able to give them, to be able to bring in data from outside sources as well as their own data, you really needed to organize that, build a semantic index. The Cerner acquisition did give us a better understanding of some of the workflows beneath the database and how healthcare works. We've also had an extraordinary opportunity to work closer with our customers to understand their needs. And I don't think that we did this in isolation. We've had a lot of great customers. We've been working on this hand in hand with providers on the front lines, with administrators that are working on value-based care, administrators working on supply chain or revenue cycle. So we've done this hand in hand with our customers.
So, just wanted to recap that because, like, I have to say, it is so difficult to rewrite anything without running into pitfalls. And so, how did Oracle really avoid falling into the trap of endless rewrites and doing things? Because seemingly you've produced this new EHR in pretty quickly and
Right.
without a
Well,
lot of bumps along the
experience,
road.
yeah. First of all, Oracle's an experienced company. We've done this type of transformation in the past, so there's a lot of lessons learned. It's not our first time at the rodeo, right? We've done this before. And I think the idea of working in close collaboration with our customers, we've spent a lot of time looking at workflows in healthcare. That's a lot of what we got from Cerner. So we weren't completely starting from scratch, right? We're rewriting it, but we're also looking at the type of workflows that normally happen in healthcare. We got a lot of that from Cerner. So That was very helpful. And then the third piece was working in partnership with our customers. But like I said, for Oracle and a company like Oracle, we've done this transformation before. So our ability to come in, assess the technology and what was there, diagnose what needed to get done, that's something that Oracle is very experienced in doing and has driven that transformation in other sectors and brought that know-how here as well.
Now, one of the clearest things that have changed in the new EHR is just the amount of AI. I mean, clearly Oracle Health has leaned right into and gone all in on AI. Why did Oracle decide to do that? And how did you determine where, AI provides real value and where maybe to hold back a little bit for now?
Right. Well, what I would say is that, look, healthcare has had some very long-standing challenges, right? We've been hearing about provider burnout. We've been hearing about access issues, quality issues. These are long-standing problems that, to date, the tech industry has not been able to solve. And arguably, the EHRs of the past actually made it worse for providers, right? They introduced a lot of clicks, a lot of cutting and pasting, and they contributed to the burnout that we see with providers. So, from our standpoint, this was an opportunity with using AI as a tool to solve some of these longstanding problems. This was an opportunity. And I think really what we see even across the marketplace is that's the direction where everybody's going to say, hey, we want to be able to use AI. What's very different about Oracle is that we're not bolting on AI solutions, right? This is at its core. We have it semantic index, organizes the data. It allows for AI agents to be able to be deployed. We have AI agents that are deployed inside our EHR. We'll also keep making AI agents available. And the other thing that's very unique is that our product comes with an AI platform. So it allows our customers to also build their own AI agents and to be able to use that inside the EHR. The other thing is important to note is that we're not just bringing a point solution with the EHR, right? We're bringing an AI platform that allows you to deploy AI, but we're also bringing a whole suite of products, right? So it's the EHR, it's the portal, it's rev cycle. We also have human capital management, our ERP, supply chain. So we really do bring a comprehensive suite of products that sit on that AI platform that allow. So we have a lot of AI embedded in our products, but we also recognize is that, look, this is just the beginning of the AI revolution. And there's going to be the opportunity to use more and more AI. We'll continue to develop. We want our customers to be able to do that. And also, we are an open ecosystem. Our platform allows our customers to be able to adopt AI agents from other innovators as well, which I think is very unique. And quite frankly, that's what's been holding back innovation in healthcare are those closed systems. So I think what we are bringing to the market is a sea change for the industry.
Seema, I just want to pick up on something you said there because that's news to me. You're saying that providers will be able to create their own AI agents because of the Oracle platform. What kinds of can you give an example of kinds of agents that providers would be able to build? Or
Sure. So let's say it's something around managing the ER flow, right? How patients come in, how we triage patients. It could be something like that. It could be clinical guidelines that we figured out a very innovative way of treating our patients with diabetes or cardiovascular disease or some sort of a cancer treatment protocol. And what this allows is they can ingest an AI agent from, let's say, another provider. They can also build their own protocols. The other thing that we're allowing is that as they build them, they can share those with other providers and they will continue to own the IP. Oracle does not take IP from other companies or institutions. So let's say a provider did come up with something very innovative. They could make that available to other providers and they could monetize the algorithms that they've come up with as well.
So very clearly not a walled garden, right? This is something that's open and people can play in the garden.
Right, exactly. I mean, that's what we're trying to draw a sharp contrast to what exists in the market today. And if we think about it, healthcare's challenges are only getting more considerable, right? If we look at some of the changes that are going on in Washington in terms of funding, it's becoming harder for providers. So they need new tools, and the industry needs innovation, and we don't want to prevent that. In fact, we want to foster innovation. We come at it with a mission approach to this, right? And driving the transformation is to honestly fulfill a mission. I think that Larry Ellison feels very strongly about is that, for governments, for employers, for patients, we all need change, and technology can drive a lot of that change. And we don't want to stymie innovation. So we're going to try to do our best to help the system, but we also want to encourage others in the ecosystem to innovate, to drive better quality, better care, better access.
Seema, for organizations and clinicians that have already started using the new EHR, what has their reaction been so far?
Well, I think they're excited, right? Because right now, if you look at the industry, you've got a lot of point solutions out there, and our product puts it all together. And it also, like I said, they're going to be thinking about other things that they want the product to do. And they will have the ability to innovate themselves because it sits on that AI platform as well. One of the really exciting pieces of feedback that we got was that, we set up some of these computers in one of our beta testing sites, and the team left. They were a little bit early, but then the doctors came. They may have come, they came a little bit earlier, so the room was set up for them, and there was no training required. They were able to just get on and they were able to use it, which I think is very exciting. So that's a testament to how easy the product is to use. It's very intuitive. It looks like all of the modern technology that we're using in other parts of our lives.
So Seema, if we sit down a year from now and talk again about the new EHR, what do you hope people will be saying about the new Oracle EHR a year from now?
Yeah, the intention of our product is to drive value for the healthcare system, for providers, and for patients as well. So we're not just bringing another piece of software to the market, but hopefully it's driving value for providers. It's making it easier for them to do their jobs. So, we're reducing a lot of the manual burden, but we're also giving them better tools so that they can drive better outcomes for their patients. For patients, we want to make it easier for them to understand what's going on with them, to be able to ask questions, to be able to get responses that are based, not generic responses, responses that are more specific to them and their specific healthcare journey. But at the end of the day, it's got to drive value, right? In terms of better outcomes, financial outcomes, quality outcomes, and access as well. To me, that's really the measure of success with our products.
Right. So it's not just the whiz bang, the nice UI, the improvements
Right.
in it's got to drive some tangible
It's got to drive
value.
value. There's got to be a return on investment. And I think that's what, maybe technology hasn't delivered before in healthcare, right? We've put products out there, but do they actually make it better for the patient? Do they make it better for the provider? And there's a lot of different ways of measuring that, right? It could be a financial outcome where, some of the tools that we're bringing with autonomous reimbursement, right? So we think we can do all of the functions that all of the transactions that happen between payers and providers. We think we can do that right off of the EHR. Well, does that lower administrative costs? Does it improve value for the payer and the provider? Are they able to transact prior authorizations quicker and faster? Are they able to avoid delays in care? So those are the tangible outcomes that we are trying to achieve. So across the board, we have literally hundreds of KPIs that we are evaluating, and that will be the ultimate measure of success for Oracle Health and Life Sciences.
Now, in healthcare, as you know, we kind of resist change.
Right.
And when something is working, we kind of don't want to change too much because it's working. So when a new release like this comes out, it is so different than what has come before. As you just mentioned, totally, AI leaning into that, having a whole AI platform, a new UI. What message would you share or give to those people who maybe a little bit cautious about moving to the new EHR, maybe who want to wait? What message would you want to give to them?
Well, I hope that people will be open-minded, right? We do a lot of complaining in healthcare about what's there, what's wrong, all the problems. I think this represents a solution. It represents an opportunity to do things differently, to produce better outcomes. So I hope that people will be open-minded. The other thing that I want to say is that in terms of AI, everything that we do has human in the loop. So these are tools. These are things that are, designed to help people do their jobs better, to deliver a better experience. But at the end of the day, the humans are always in the loop when it comes to AI. So if there's concern or caution, I think people should always understand that. The other thing that I wanted to add when we think about what our product is going to do, I talked about supply chain management, talked about ERP, talked about the financial transactions. The other thing that we're doing, which is very innovative, is around clinical trials. So right now, today, we've got clinical trials over here, and we've got healthcare delivery over here. But really, it shouldn't be that. There shouldn't be this gap between the two. And our new EHR, you'll see, especially when we actually release the acute EHR, that will allow providers to conduct clinical trials right inside their EHR. So we're talking about all of these products that have been out there, separate products, and we're kind of bringing it all into a common experience for our providers.
And I think that'll be music to a lot of people's ears, because a lot of that data that's in the EHR is so valuable for the clinical
Right.
trial process. But when the systems are separate, it's been kind of a challenge to get to share it.
That's right. And one of the things that we'll also be releasing, you'll hear about this at our summit, right? It's the EHR, but we're going to be talking about our life sciences and our clinical trials suite. We're also bringing AI to automate that entire process. As we know, part of the reason why drugs are so expensive is that it's a lot of work to run a clinical trial, and there's a lot of delays, a lot of manual work that goes on there as well. And we're bringing AI to that process as well to automate it. So to automate the study protocol, to automate the entire process of clinical trials. So that's also an exciting development. The other thing that we're bringing is our data intelligence around clinical trials. So what we call our learning health network. So these are providers that have agreed to donate their data for the purposes of research, and we'll be making that available. So we'll allow the ability to use that data. You can also bring in your own data, and then we bring, AI to our analytical tools to help analyze that data. So I think that that's also something in terms of driving transformation. It's not just transformation in healthcare delivery, but it's transformation in healthcare innovation to help new cures, new treatments by completely redesigning the clinical trials process and hoping to facilitate more research as well.
Well, I'm excited for the Oracle Health and Life Sciences Summit that is coming up. I'm looking forward to seeing you on stage. You've already previewed a couple of things that will be happening at the summit. Or is there anything else that you could preview for us that we might be hearing about at the conference?
You're gonna hear about this end-to-end transformation, right? So it is really just not about just the EHR. It's an entire suite of products that sit on that AI platform that allow people to develop their own. And it really is end to end. And you're going to hear a lot about the life sciences pieces as well. So I think it's going to be exciting for us. I think it's also a milestone for Oracle Health and Life Sciences that, it's taken us some time to put our arms around this, to analyze the problem and to figure out the solution. And this is the year where you're seeing our products, right? Our new EHR came out. One of the other things that we've been working on is trying to reduce the friction between payers and providers. We released our clinical data exchange. This is a product that we can implement in 2 weeks. We can get providers onboarded within an hour, and it allows them to move data back and forth between payers and providers, right? The providers control what data that they want to share, but it's faster, it's quicker, right? It allows them to hopefully retire the fax machine for good as well. And then you're going to see us talk about all kinds of innovation that we're going to bring around the whole revenue cycle so that it just makes it a lot easier. And then we're going to call it our autonomous reimbursement, right? So it just makes it bringing AI to those processes as well.
I'm sure a lot of your customers will be very happy to hear that, given the pressure that they're under in terms of the financial side of things. So RCM definitely in the focus. Well, that's great. I'm looking so forward to it. So final question, Seema, for you. Where can people go if they want to dive deeper and actually get their hands on the new Oracle EHR?
Right. Well, come to the conference. That's always a great place to start. And literally, there's many ways to contact Oracle Health and Life Sciences. We have lots of people asking us for demos, lots of requests to see the products. And we're always happy to oblige. We also have, a number of events that we'll be having across the country to actually demo the new products. So, we'll actually be doing that in local areas as well.
Well, Seema, thank you so much for coming on the program. I know you have a very busy schedule, so appreciate everything you shared with us today.
My pleasure.
Wow. I really enjoyed that conversation with Seema. It will really be interesting to see how Oracle Health's new EHR performs in the market over the next 12 to 18 months. I have to say I'm impressed because the company seems to have pulled off a major development feat, completely rebuilding their application from scratch on a new database, on a new tech platform, integrating it with Oracle's other applications, and baking AI into their application right from the start. That is not an easy thing to do. Drop your thoughts on the Oracle Health's new EHR in the comments below. And if you found this discussion helpful, don't forget to like and subscribe and check out the other interviews on this channel. I'm Colin Hung, and I'll catch you on the next video.